Battlefield injuries, including impalements, embedded objects, and eviscerations, can be particularly traumatic and irregular. These injuries may require special care to make sure the wound isn't exacerbated. When dealing with an impalement or an embedded object, the first rule is to never attempt to remove the impaled or embedded object. This could cause additional trauma or dangerous bleeding. The impaling or embedded object is often controlling blood loss. If the casualty is conscious, tell them to remain still and not move or disturb the impaled object. First, expose the impaled object by carefully cutting or removing clothing to expose the wound site. Control any bleeding. Direct pressure should be applied around the object to the wound with a bulky dressing that stabilizes the object and prevents movement. Cautionary note: do not exert force on the impaled object or on the tissue directly adjacent to the edge of the impaled object. Do not anchor the bandage to the impaled object. That is, do not wrap the bandage around the object, or exert pressure on the object while applying the bandage. Again, do not move or remove the object. If an object is embedded in the casualty's eye, place dressings around the object to keep it stable and cover both eyes with bandages. This is to prevent the casualty from moving their eyes and putting any strain on them while an impaling object is present. The casualty should rest their eyes and move them as little as possible. If the casualty's circulation is impaired by the impaling object, evacuate them as soon as possible. If the impalement wound is on a limb, recheck the casualty's circulation below the bandage after you've wrapped it. If blood flow was not impaired before the bandage was applied, but is now impaired, loosen and retie the bandage, then recheck the circulation. If circulation is still impaired, evacuate the casualty as soon as possible. Note: in some circumstances, it may be necessary to shorten the protruding object in order to move or evacuate the casualty. Monitor the casualty and treat them for shock if needed.